Sharon Elaine of the Filipino Community Center. So pag-usapan naman natin, I know recently madami kayong campaigns na na-involve ang FCC. One is the welfare and rights of Filipino caregivers. Talk about it, please.
So in doing a lot of the services and programs, engaging a lot of community members in the Filipino community, a lot of us know that, either somebody's related to a caregiver in their family or they themselves are caregivers. So it's a huge industry that's actually growing because of the baby boomer generation really aging right now. And so the growth in the industry, and the Filipinos have been a big part of this industry, a large percentage of the workforce caregivers in the Bay Area and around the country. So given this, we also know that the situation and the conditions of work of caregivers are very difficult, and so, working with the seniors and families we've been working with, a lot of caregivers have been coming in. We have a small program that actually helps people file claims if laws in the San Francisco labor laws are being violated. So in doing some outreach around the labor laws of San Francisco, there's a higher minimum wage, there's paid sick leave, and there's free health care security ordinance. We've been doing education about that, but along the way, I've encountered many Filipino caregivers in San Francisco and around the Bay Area. And so we started doing work with a couple of caregivers who were having a difficult time with an employer, being paid under the minimum wage. But beyond that, the working conditions were really harsh. They were working 16, 18, 20 hours a day, being woken up by the patients, doing everything for the family and the patients, but being paid under the minimum wage. We know our undocumented DNT population is facing even worse conditions as caregivers. So the conditions have been really difficult for people living in as caregivers that are working in facilities, these larger care homes. So in doing that work, we were actually finding legal resources to help them file their claims, and we had a big victory just last year in April. First, it was to reduce their workday officially from them working 16, 18 hours a day down to 8 hours officially, and then beyond that, the back wages that they were owed, the overtime, they got a settlement of over $70,000 for two caregivers.
Wow.
So when we won that campaign and we pushed really hard, and we're now gathering caregivers to talk about their issues and launching a research project this summer, when we publicized that in the Filipino press, we had an overwhelming response. People were calling us from all over the country. I'm a caregiver in Nevada. I'm a caregiver in Florida. Can you help us? And so we've been reaching out to our networks. We're part of the National Alliance for Filipino Concerns. And NAFCON has been taking up the issue of caregivers and domestic workers, which is also a growing campaign around the country and around the world, actually. Some recent victories there, but our small part of finding caregivers in San Francisco and the Bay Area is growing now, and it's a campaign that we're very excited about.
That's excellent. And you also were involved with the Filipino nurses and CPMC?
Yeah. So, these are campaigns that have been growing. Another huge industry, Filipino nurses have been recruited since the early 1900s, coming to the U.S. to work in the healthcare facilities here. So Filipino nurses having come here, they face all kinds of discrimination, language discrimination, discrimination in pay, all of these things. There's large Filipino nursing associations, but up until this day, we were hearing stories of Filipinos being fired for speaking Tagalog on their breaks, in Virginia. So it's a big case, a class action lawsuit, and they actually won. But here in the Bay Area in San Francisco, we heard from 3 nursing supervisors and managers that they were told directly by the Vice President of Nursing of California Pacific Medical Center, CPMC, not to hire any more Filipinos or foreign graduate nurses. This is a blatant discriminatory hiring directive. And so we had to investigate, and we had to look at it as a community. And so we confronted CPMC to see, did this actually happen? Could they deny it? And would they, nursing managers and supervisors had 3 sworn statements that they heard these in meetings from the Vice President of Nursing. Since that time, they haven't provided a sworn statement that this did not happen. We've met with them, and of course they denied it, but we're pushing the campaign to ensure that this doesn't happen at CPMC, any hospital in San Francisco or anywhere.
So this is still an ongoing thing.
Yeah, so we've actually tried to put these campaigns together in a general campaign for justice for all Filipino workers. So it's called Caring for Those Who Care for Us. So Filipino caregivers, Filipino nurses, even hotel workers in San Francisco are facing a difficult time in this economic recession. So workers, in all of these industries where there's so many Filipinos, hotel workers, nurses, caregivers, we want to make sure that these industries also don't exploit our community, of course, but also treat our community well. So the hotel workers have been fighting for a fair contract since 2009. They're also fighting for a basic thing, healthcare benefits they've had for a long time. The corporations are now asking them to pay more for their own healthcare. So those kind of things. So we've been supporting Filipino hotel workers, all hotel workers in San Francisco, one of the biggest industries in San Francisco. We're working with the local unions, so Local 2, Unite HERE, has a lot of Filipino organizers and Filipino hotel workers. So these are three big campaigns that have been happening recently. And to me, they're all related to this difficult economic recession that we're facing. So, workers are struggling to support themselves and their families, but at the same time, they shouldn't be exploited and they shouldn't be treated unfairly. So,
talking about the economic downturn, naka-apekto ba sa programs ng FCC? Did you have to cut down on some?
Yeah, definitely. I think budget cuts is all around. It's not just the services. I mean, there's already a deficit. There's already a huge need already for resources and services, particularly ones that are culturally competent and culturally relevant. And with the economic downturn, we have been hit with a lot of budget cuts, but really the way we see it is there is money out there, there are ways to find the budget and the resources for the services. We just have to prioritize the needs of our community. Currently, that's one of the things that we do work with in tandem with our partners, and in tandem with the politicians inside City Hall, is really ensuring that these basic services are always protected. We're seeing with the struggles of these workers, the caregivers, the nurses, the hotel workers, even more, we need services to provide for them. They need lawyers, they need people to look for jobs, we need people to look for resumes, and teach computer skills. As the economy is spiraling down, there's less and less jobs and there's less and less opportunities for our community, and so there's an even greater need to provide these basic services for them and to help them. And these budget cuts, all they really do is make an already bad situation worse.
And how's the support ng community natin? Kasi madami din kayong natutulungan. Nape-pay forward ba nila in turn?
Oh yeah, definitely. I mean, even something as basic, the things that we get is just even basic support, as one combined to another, giving us help when we need things inside the center, when we're hosting activities. We're always looking for donors and donations and private donors, so that we can do a more varied work that we see that's needed in the community. And even just as basic as coming to be a part of the center, participating in our activities, we really see that as a contribution to the work that we do, because the creation of these networks that we have, that's what sustains our work. It's not the funding, it's not the staff, it's really the network that's there.
Right.
And in the end, it's going to be the community advocating for what it wants, more so than FCC as an organization and our staff doing all of that work. In the end, if it's not caregivers standing up for their rights, hotel workers fighting for a fair contract, or the nurses standing up against discrimination, those are the things that are going to change the economy, even in the situation in San Francisco. So with the upcoming election of the mayor, so we want to make sure our issues are forefront coming from the Filipino community.
Oh, we have to pause for another break, but don't go away. More talk when we return.